Thank you for purchasing Accu-Dent System 1 for complete denture edentulous impressions. To ensure superior results like these, this presentation will demonstrate various time-saving steps and techniques for taking a superior impression, including tray selection, operatory setup, maxillary impression, and mandibular impression. Your kit includes a complete set of 5 maxillary and 10 mandibular edentulous impression Accu-Trays in a plastic tray box, a box of syringe Accu-Gel, a box of tray Accu-Gel, a syringe, water measuring vial, thermometer, tray caliper, finger grip extender, tray holder, and a technical information package. In choosing a maxillary Accu-Tray, select one that is 4 to 6 millimeters wider than the maxillary tuberosities. When in doubt, use a larger tray. It is important to try the tray in the mouth to make sure there is sufficient clearance. Mandibular tray selection is accomplished in 2 steps: tray type and tray size. First, determine if the patient has a good or poor ridge. Good to fair ridges will usually require the use of a 25 to 29 tray, and poor ridges the 20 to 24 trays. Then, with the supplied calipers, measure the width of the residual ridge in the first molar region on the denture or in the patient's mouth. Line this measurement up with the centers of the large holes in the first molar region of the lower tray. If in doubt, use a smaller tray. The suggested operatory setup for one impression includes 1 opened package each of System 1 syringe and tray gels, 2 mixing bowls, 2 spatulas, a syringe, a water measuring vial, the selected size of the Accu-Tray, water at 70 degrees Fahrenheit or 21 degrees Celsius, and gauze. A bowl of water left at room temperature is an easy way to get the proper working temperature. Measure out 70-degree water to the first line on the water vial and pour in the smaller mixing bowl. Measure out water to the third line on the vial and pour into the larger bowl. Pour the syringe gel powder into the small bowl of water and spatulate for 15 to 20 seconds until smooth. The syringe gel has 30 seconds more working time than the tray gel and is mixed first. Backload the syringe and replace the plunger. Set the syringe aside. Mix the tray gel next by pouring the powder into the larger bowl and stirring. The mix will appear too dry, but it is important not to add more water. Continued spatulation will create a smooth mix. Load the tray gel into the impression tray and push the gel through the large holes, which is important for retention. Place more material in the anterior part of the tray, sloping to very little material in the posterior. Pat out the creases before wetting the surface of the tray gel. It is very important to give the tray gel a surface wash by holding it under cold running water and smoothing with your fingers. You can also finalize the shape of the tray gel at this time. Wipe the vestibules and palate dry with gauze. Express a line of the syringe gel into the mucobuccal fold from the hamular notch forward to the midline. Repeat on the other side of the arch and place a small amount of syringe gel in the anterior vault of the palate. Bring the loaded tray to the mouth and merge the 2 materials together in the anterior and rotate the tray upward to the posterior. Stop when a small amount of syringe gel appears at the distal edge of the tray gel. Border mold by pulling straight down on the philtrum at the vermilion border. Massage the cheeks very lightly downward with the fingers on both sides and have the patient open wide. When the gels are set in their bowls, break the impression loose at the distal buccal periphery and remove. Use of the handle alone may cause the dislodgement of the impression material from the tray. Within 5 minutes, disinfect and pour the model. For mandibular impression, follow the same steps in mixing the Accu-Gels as for the maxillary arch. When loading the Accu-Tray, make sure that some tray gel is pushed through the holes of the tray for better retention. Load the tray by placing half the tray gel on one side of the tray and half on the other side. Move some gel to the front of the tray and pat out the creases before wetting the surface. Most of the gel should be in the posterior of the tray. Give the tray gel a surface wash under cold running water and rub the surface smooth with your fingers. You may finalize the shape of the tray gel at this time. After drying the vestibules and lingual area with gauze, express a line of syringe gel into the vestibules from the retromolar pad forward to the midline on both sides of the arch. It is not necessary to place syringe gel into the lingual vestibules. Bring the loaded tray to the mouth in the anterior first. Have the patient push their tongue forward as you rotate the tray backward. When the tray gel rises up above the retromolar pads in the distal, stop the seating pressure. When the gels are set in the bowls, loosen the impression at the distal buccal periphery and remove carefully. Use of the handle alone may cause the dislodgement of the impression material from the tray. Next, within 5 minutes, disinfect and pour the model. These are some examples of the accurate results you can achieve with Accu-Dent System 1. As you can see, this system allows you and your laboratories to make more precise restorations from better models, which will reduce the number of chairside adjustments later. For more information or technical questions, please contact our customer service department at 1-800-5-DENTAL in the United States or 1-800-263-8182 in Canada, or visit our website at www.ivoclarvivident.us.com. Ivoclar Vivident thanks you for your support.